All right, good morning, good afternoon. Look how dark it is outside. I was thinking it was morning for a second. Nice to have all the rain. Thank you all for being here. My name is Todd Armstrong. I'm the VP of Health Services here at Westminster Village. And today's presentation is on the community membership in relation to health services. And so thank you for being here. If you're not a community member, you're still more than welcome to be here as well. Is there anyone who hasn't received one of the guides that was passed out today? If you would like one, please feel free to raise your hand and we'll make sure one of our ladies get one to you. Right. Excellent. Looks like everyone has one. Okay. Let's get started. All right. The first and main point I really want to make is that all health-related services here at Westminster Village are available to our community residents as well. I know sometimes there's confusion with that. The difference is that it does come with an additional fee. As I passed out these health services guide, I know as you go through there might be some questions that you have later on. There's contact information on the back of the guide as well, so depending on the area you may have some further questions on. You can always defer those questions to those individuals as well so they can get a little bit more information for you if you're needing some clarification on some of those pieces. I'll go through this presentation. This is a smaller presentation today if you've been to some of the previous ones, but we will open it up to questions and answers at the end of the presentation. Okay. So to dive into a little bit of what some of those additional fees are, so if you were to have the access to the Wellness Center, home health, and the emergency response as such a Life Care member does, for a community member, it's $230 additional per person per month with that. And then for Sackton, if you were to need to move to Sackton, it would be an additional $3,435 per month. And for Wyrick, it's an additional $4,590, and that would be for a semi-private room. Okay. I wanted to do just a quick review here on the change of fees over the last few years. So if you look in 2018, to come in as a community member was about $25,000 to $35,000. And you'll notice underneath all of these, there's an additional $25,000 fee for a second person. 2019, that moved to $50,000 to $70,000. And then 2020 was $55,000 to $90,000 for that initial entrance fee. And then in 2021, we're currently at $60,000 to $95,000 for that first person, and then the second person fee. And listed under them, I also have, you can see where Sackton in 2018 was $3,105, whereas Wyrick was $4,140, and that's increased over time to where we are at today, which is the $3,435 and the $4,590. Okay. Wanted to talk a little bit just about the pros and cons, and if you did attend the Life Care version as well, very same template, just with the information changed to be specifically to the contract. So for this being community member, the pros is that it is less upfront fees than you would pay for a Life Care membership. Some of the cons would be that you would be subject to the going rate at the time of service for Sackton and or Wyrick Healthcare Center. There's no stated tax benefit, and then there's a non-refundable upfront fee as well. I've had a few individuals ask me right before the meeting if they might be able to have a copy of this presentation. So if you wouldn't mind, Anna, if we could have that available at the front desk as well. And if someone else you know that is a Life Care or community member and they're wanting a copy of the guide, the front desk also has a copy of those as well. Okay. All right, and then this graph just shows the breakdown of both Life Care and community under residential services and health-related services. So I'll read through those in case it's a little too small up there. So for occupancy of the apartment, that's included for both. Westminster Village dollar allowance for meals, included for both. Housekeeping, included for both. Maintenance and transportation, flat linen laundry service, activities and events, fitness areas and pool, all of those are included for both life care and community. And then where the differences are the health-related services. So the wellness clinic is included with life care, and it would come with an additional fee for community, which is the same for home health, the 2 15-minute CNA tasks per day. That is included with life care, but with an additional fee for community. Sacton, that is included with life care with an additional fee for community. A semi-private room, meaning 2 individuals would potentially be in that room in Wyrick Healthcare Center. That's included for a life care member, and that would come with an additional fee for a community resident. And a private room in the Wyrick Healthcare Center would be included at an additional fee for both life care and community. And then any independent living emergency response would be included for life care and an additional fee included for a community member. Okay? As I mentioned, this guide has a lot of information in it. It's a great resource. Several years, about 2 to 3 years ago, a team of employees and residents, representation from the resident council, met together to really create a guide out of requests from our residents to really break down the different areas. And so there's a lot of information in those. They also include, at the end of each section, they include a little example of services provided. So if anyone has the name Mr. or Mrs. Smith, I apologize, but that was typically the name we used. All right, and with that, I would like to open it up to questions and answers. I know I said this one was a little quicker, so please, looking forward to hearing any questions. Thank you, Anna, for bringing the mic around.
On page 2 of this, on page 2, you said that the additional fee to go into Wyrick is $4,000. Does that depend upon the size apartment that you have?
So the additional fee of, let me get that exact number for you. So the additional fee right now of, did you say Sacton or Wyrick? So the question was, is the additional fee for Wyrick dependent on the apartment? So you would still pay your normal service fee that you would pay depending on your apartment size, and then it would be an additional $45.90 for Wyrick, no matter what your apartment size was. That would be what would be added on to your service fee. Okay. I'm going to follow the microphone.
Todd, the very last thing on this slide, independent living emergency response, could you address that a little bit, exactly what that means? What type of emergency response are we talking about?
Yeah, and so I'll read that first paragraph here on page 2. What is in-house emergency response? Emergency services is a multi-response capability that may include our own security and nursing employees showing up to provide response to a health-related emergency on Westminster Village property.
What is it?
Does that answer your question? And it has different questions for that. It says what services are provided, and this includes, a unique security team that we have EMTs. You may have an LPN respond or a CNA, sometimes a registered nurse. When we're notified of the alarm going off, we're sending someone to respond. It also mentions down in there what are the fees. It talks about a flat fee of $100 for an in-house emergency visit. And that's also why we like to promote, as we mentioned, and I think it was the second slide, that for $230 per person, you have access to include those home health, emergency response, and wellness center package for that $230. Okay, thank you.
I'm sorry for this.
That's okay.
There are probably two different groups of people here who are community members. One of them are self-paying for whatever happens, and the others are covered by insurance. For those of us that are covered by insurance, I would imagine for the most part that everything that you have said is covered. It also says that, there's something up there that says not deductible, not tax deductible, or whatever. I don't understand what that was. But my question is, every January we get a document from Westminster Village that tells us how much we can deduct from our annual payments here for income tax purposes. If your insurance company is paying for absolutely everything, then why did we get an insurance allowance for $37,000 in January? Are community members also supporting the same services that that others are using? Because that money has to go somewhere. Where is it going?
So I'm probably going to defer part of this question to our CFO, who happened to be in the back here. So thank you, Mr. Garth Begwin.
Thank you. Give me the question one more time. I was following you for a minute and then I lost you.
What's the day that comes after Monday?
That would be Tuesday. Or Wednesday.
The question is, if you're totally covered by insurance, I mean totally, with no cut-off, nothing, where is the $37,000 that we were allowed to deduct from our income tax in January? Where was that money going once you get it? What are we paying for, and yet being, done for absolutely every single thing on this list, which is okay because we're not paying for it, but where is the money going?
That's an interesting question. So as far as the tax part goes, we have our contracted CPA firm. We submit them data, they come back to us with the number. That number is essentially saying out of all the dollars that you pay per month on your monthly service fee, a certain portion is deductible on your taxes as medical expenses. However, your individual tax situation results in you declaring any type of medical expense, that's between you and the IRS. That doesn't have anything to do with us or where we get.
Where does the money go?
There is no money. Which money are you speaking of?
The one that I get to deduct from my monthly payments.
It's just a calculation done by the CPA firm that says because you live in this type of an environment, a life care community, a portion of your monthly fees qualify as medical expenses. So if you were living outside, right, in your own personal home, you went to the doctor, that's a medical expense. Part of living here is a considered medical expense when it comes to the IRS and the laws.
That's not the answer. That's not the answer, because the question is, why am I getting that deduction in the first place?
Yeah, it would be between you and your tax.
Forget the outside. I'm talking about the inside. If that amount of money has been deducted from our...
It hasn't been deducted. Nothing's been deducted because that number is different every year. Just because the IRS says this much qualifies as a medical expense doesn't mean that you're literally having portions of your monthly service fee taken out. This is medical, this is food, this is for the pool, this is for the elevators, this is for the lights. That's not how we bill. It's something that has to do with the law, it has to do with IRS revenue rulings, it has to do with the tax courts. There's not any portion that we're saying, all right, because you live here, we took this and we gave it to Todd. That's not how that works.
It's really very simple. You're not getting that money. If you're entitled to it, your accountant will take care of it when he does your taxes. But you're not getting it unless you're entitled.
They're getting it.
No.
We're getting your rent. Every dollar we get is from you, right? You pay your rent and we get that money. That's.
And why is it deductible from my income tax?
You'd have to ask an IRS lawyer.
I'm asking you.
I'm not a tax professional.
It's not necessarily deducted. It's according to if you You're probably, you're probably not getting it, so don't worry.
The confusion for me was in a slide before here, where it said in the community column that tax deduction may not apply. And it implied that for the life care, that it would. So that discrepancy is my question.
Sure. The reason for that is that the IRS has addressed in both court cases and revenue rulings that a life care community contract, a Plan A contract, which is nationally recognized in the industry as an identifiable and a knowable thing, they've acknowledged that under those circumstances, with those type of contracts, this situation applies. And again, we forward the data to the CPAs, they determine the calculation for us. The reason that it mentions, I think it says there's not a stated tax benefit for the CMA fee, or for the CMA contract, is because neither the IRS nor the tax courts have ever addressed that type of a contract. So at that point, again, we're not tax professionals, we don't work for the IRS, we send that out to a CPA firm who does the calculation for us. Once that goes into your hands, from us it's information. For you, you take it to your individual tax accountant, your CPA, whoever who does your taxes or helps you with your taxes, and it's up to them to decide whether or not, based on your circumstances, that you would qualify for that type of benefit.
I understand that it might be tested in court sometime.
Eventually it could be, sure.
But thank you.
But up to this point, it has not yet. So we're not the professionals to say, yes, it counts, or no, it doesn't count. These are the facts that we have, and that's all we can really say, of what we know about it.
Thank you.
Sure.
Garth Bagman, everyone. Thank you.
My CPA said that, community members cannot deduct that on their income tax. However, I know 3 parties here living here that do, and this never seems to be questioned. So you might think about that. A question that I have as a community member, if I have emergency and the EMT comes and the nurse, and I decide I don't want to go to the hospital, what charge do I have then?
Currently, it's a flat $100 rate unless you're part of the $230 per person program.
What about the ambulance that came?
So that wouldn't be part of us. That would be based on you and your insurance if the ambulance were to take
So, do you think that your hospitalization would pay for that, or Medicare would pay for the ambulance?
Yes.
Potentially, depending on what your insurance is, usually that would be part of the coverage.
All right. One last thing. A number of us have long-term health care. And I think you and I discussed this at one time, but when it comes time to submit those forms, what kind of help do you provide for that?
If you're in independent living, you could reach out to Sheila Lawrence, our social services, and she could make sure that she's providing the resources to guide you.
Would she contact the insurance company and request the forms? Would she do that, go that far?
It would best to have that discussion with her. I know she'll help you through it, and so if you're needing assistance with contacting, I'm sure she'd be able to help you.
I think at that time probably we will need help. Thank you.
I have a couple of questions. Number one, isn't Wyrick going to become all private rooms when it's remodeled or not?
Right now, the plan, and so we're still working through that planning phase of what will actually happen, but right now the conversation is to have both private and semi-private. So the majority we're looking at will be for private rooms right now, but there will be semi-private rooms also.
All right. Secondly, I'd like to know the rationale for why when a person currently lives in an FGI
I love deferring these, so please continue.
apartment as compared to someone living in a D or C or lower monthly charge, why are we paying for extra square footage when we go to Wyrick? than anyone else?
I really appreciate Tom's answer on this. So Tom, I'd love to hear it. Okay.
So that would have been a fantastic question before you signed a contract saying, I agree to pay the same monthly service fee for the rest of my time at Westminster Village. So the answer is, it's just the way this organization and almost every other life care organization works. Residents move into the independent living apartment, and their fees are based off of that apartment for the rest of their time, whether it's in assisted living or skilled nursing. It's, why?
Yep.
Because it's the only way the system works. It's the reason that everybody does it this way. Because our system would have to charge more to everybody when they move into independent living to be able to reduce the rates to some and increase the rates to others when they need that higher level of care. It's the way it's worked for 30 years. My guess is it's probably the way it'll work for the next 30 years for us and most other facilities. When people move into Westminster Village or Friendship Village or any other place, they typically want the largest apartment they can afford. Right? So we move into the largest apartment we can afford, and when you go to, most of the time when you sign, especially the life care contract, you're doing that because you want your fees to remain as close to the same throughout the end of your life. So if you moved into the smallest apartment and then your fees went up when you need that higher level of care, you probably wouldn't be able to afford it. So the promise that's been made to residents as they've moved in is your monthly service fee is probably not going to go up more than 3.5% as you go through the levels of care. If you're in the smallest apartment and your fees doubled when you went to the lowest level of care now because we changed our system, it would cause major negative effects for those residents. And the other side is then you would either drop the price down for those residents in the highest apartments, but I tell you what any business would do is they would say everybody's going to pay the highest number most likely. And we don't think that change is something that would be good for us as an organization or for the residents, but we try to be very clear about that when people move in, when they're on the wait list, is that fee's going to follow you through all the levels of care. If I could go back 30 years and do it over, I may change the system because I've been hearing that question for at least 13 straight years of why is it this way? And I wish I had a better answer, but it's the only way the system works because we started it that way and there's no easy transition. And by easy transition, I don't mean just a transition where we change it immediately, but there's not even an easy 5 or 10-year transition in the way we do that business. Especially because one of the things we try to do is be similar to the other like facilities, because when people come and look at Westminster Village, they usually look at 3 or 4 other campuses, and it's easy when they can compare the types of contracts, the types of care. So having a similar business model to those other campuses makes the decision easier for people to move into a place like Westminster Village. So it's, again, I know there are a couple of questions that come up on a regular basis that people won't like the answer, but it is just the answer, unfortunately. Yes?
I'm confused when I asked the question, the first question.
Yeah.
It said that if you move to Wyrick, you go up to $4,300.
Yeah.
Now you're saying it depends upon your apartment.
No, so let me answer that question because it's 2 different questions. If you have a life care contract and you move to Wyrick, there's no additional charge other than incidentals. That's because you paid a larger entrance fee so that when you move to Wyrick, your price remains the same. If you have a community membership contract, you pay your monthly service fee, whatever that is, whether it's the smallest apartment or largest apartment, plus you pay a community membership fee. You pay that additional $4,500 a month. So a person in the smallest apartment, let's say it's $3,500. You pay the $3,500 plus your $4,500 fee when you go to Wyrick. Your apartment fee doesn't change, but the community membership comes on top of it. So that's the question asked over here. When you go to Wyrick, your monthly service fee is dependent on your independent living apartment. So if you're in a B, you're paying a B monthly service fee. If you're in a G, you're paying a G monthly service fee. But the additional $4,500 is the same for everybody who's a community member. Does that answer it?
Yeah.
See me after and I'll show you.
They get confused between community and healthcare, and that's what the difference is.
Yeah. So community and life care. So life care was that larger entrance fee, and that's to keep your monthly service fees the same other than the annual increases throughout the levels of care. So it's paying for that health care before. Community members chose to have the lower entrance fee where you pay for that health care as you need it.
If you go into the assisted care and you pay the additional $3,000, and then you go into Wyrick, you still have to pay the $3,000 plus the $4,500?
No, just one or the other. One or the other. Yeah.
Okay.
Yeah. So
plus your rent,
your monthly service fee. So if you lived in assisted living and then you had a short stay in Wyrick, we would not charge you both community membership fees at the same time. And if we did, you'd come and see me and we'd fix it.
And I also might add, regarding the last two bullets, if you're moving to Sackton or to Wyrick, that's what your long-term insurance plan is for.
Yeah. And whether you're a life care member or a community member, your long-term care insurance will reimburse you for whatever amount your policy covers. The other thing that's happened is I think a lot of times when community members move in, they have the long-term care insurance, or we think we're never going to Wyrick or Sackton assisted living. And that's a pretty good guess for most people, because most of our residents never live in Wyrick or in Sackton assisted living. Most people live in their apartments until the very end, or very close to the very end. There are some people that live in Wyrick or Sackton for 10 or 15 years, but that's the rarity. So when that happens, one of the things that has happened, and one of the things every one of your contracts allow for, is to change your mind. So if you find out, oh, I need to go to Wyrick and I think I'm going to be there for 5 years, you can change to a life care contract and avoid that $4,500 fee. So that is a possibility. We've had a number of people do that. And again, if that's the right choice for you, then that's the right choice for you. But we wrote that into the contract so people have that opportunity.
How much would that be?
It depends on what apartment you moved into, but I believe, and don't quote me on this, but I believe what the contract says in most cases is you would pay the difference in what you paid for the CMA fee to what the life care fee would have been at the time you signed the contract. And in most cases, 2 to 3 years in Wyrick, you would have been better off signing the life care contract. Or if you're using a lot of home health, or in Sackton assisted living. But I believe everybody's contract has that opportunity to make that switch if it makes sense. And then I think we've had a few people switch, or at least talk about switching, because they had long-term care insurance. And one of the things we've seen with a lot of long-term care insurance policies is the premiums are going way up and the payouts are going way down. So just because you had the long-term care insurance 3 or 4 or 5 years ago when you moved in, you may still want to look at that and go, does that still make sense over a long period of time? Okay.
Tom Winkleman, everyone. Thank you, Tom. Thank you, gentlemen. All right, are there any other questions for me? Like I mentioned, these will be videoed as well, so you can review these. Anna will have the contracts and also a copy of this presentation up front at the front desk if someone would like a copy. And please utilize these health services guides. There's a lot of time and effort put into these to really make sure that we can be as clear as possible. We have a question over here. And there's some information in the back on different areas to reach to get more information on those areas. Yes, your question?
I'd like to know, since you changed the licensing, whether someone can review my long-term care contract to know if it still applies to my contract or to anybody who's interested in finding that out.
Absolutely. Anna, could you have her information for me so we can make sure somebody can do that? Thank you.
I'm a former nurse, and my question is, if one of my neighbors requires a dressings change, and I can do that, should I do that? Will that change her status with healthcare?
So our recommendation is any health services you're needing here to utilize our health services team here. I will say individual decisions that are made from residents in independent living are those individuals' decisions. All right, thank you everyone for your time. Appreciate it.